In 2021, Dr. Britt Lipman, a practicing psychologist in New York State, wrote an article titled Misdiagnosis of Deaf Individuals Towards a Culturally Sensitive Approach. She wrote this article for New York State University's online publication of undergraduate studies in the Applied Psychology Division. In this article, she explains that during her time of clinicals, she experienced more experienced psychologists and psychiatrists treating deaf individuals as if they were psychotics. She also explains that there is a massive cultural difference between deaf individuals and hearing individuals. Deaf individuals who became deaf before they were able to form language are known as prelingually deaf. These people typically, when they try to write in English, write in very discombobulated sentences that do not make sense structurally to somebody who speaks and reads and writes English proficiently. These are often interpreted as delusions. They also tend to behave more erratically than hearing individuals do because of how emotive of a language ASL is. It requires more facial expressions, requires wider arm movements, and at times will include slapping their legs and slapping the floor, which oftentimes is interpreted again as delusional behavior. Dr. Lippman also explains that while she was in training and in school to become a psychologist, she was taught very ardently that she needed to be open-minded to new cultural approaches and to cultural differences that could present themselves as her time as a clinician. And she says it is very interesting how, although she was taught to do this, the people who were teaching her these things were not aware of the stark differences between deaf culture and hearing culture. Because under closer examination, people who are familiar with ASL and are familiar with working with prelingually deaf patients recognize that these people were not psychotic, they were not delusional, and they were not suffering from hallucinations. They were in fact suffering from something as simple as anxiety or depression. And so in this article, she outlines how it is incredibly important for the culture of deaf people to be taken into account by hearing practitioners, and how there needs to be open availability to practitioners who are fluent in ASL or who have direct and open access to interpreters who are also fluent in ASL.